Hello, my name is Marquise Howard, and today I'll be presenting a proposal to Dr. McConnell over at Children's Medical Group. Children's Medical Group is a pediatric office that employs medical professionals in the healthcare industry. Children's Medical Group is a company that commits to providing quality medical services to children. In the healthcare industry, companies are tasked with providing essential medical services. The challenge that I'm looking to solve using scientific evidence is the high turnover from employed workers at Children's Medical Group. From anecdotal experiences at Children's Medical Group, the main concern is that workers don't believe management offers a transformational leadership style. The purpose of the proposal is to learn ways management can lower turnover within Children's Medical Group. The goal is to bring awareness to high turnover and implement policies that promote a transformational work environment. This proposal to Children's Medical Group Human Resource Department will include recommendations that promote better management and recruitment strategies to fix the turnover issue. When conducting my research for this proposal, I gathered evidence from articles and peer-reviewed journals. I found the evidence using search databases, Business Source Complete, PsycInfo, and Google. I used the keywords high turnover and medical workers to narrow down my search. After finding studies, I critically appraised the quality of evidence. Moving on to my assessment of my evidence used. In the article, Burnout and Healthcare Workforce Turnover, the article covers 2 San Francisco healthcare facilities that have experienced high turnover rate due to burnout of the employed workers. My next article, a path analysis study of retention of healthcare professionals in urban India using healthcare information technology, covers a retention strategy that combats the high turnover issue among healthcare workers. My next article, prevalence and correlates of stress and burnout among U.S. healthcare workers, provides a study showing that a high percentage of nurses and physicians experience burnout due to their work. In the academic journal, the relationship between leadership style and turnover intentions of nurses in the public hospital of Jordan, it details the effect that transformational leadership has on the increasing turnover in the healthcare industry. Results from that article show that 60% of nurses would like the idea of management developing a more transformational leadership style. The evidence provided me findings that suggest healthcare employers are experiencing a high rate in turnover amongst their workers. Workers in the studies provided indicate that burnout and lack of professional development is the cause. From what I've gathered, incorporating development groups that establish a better relationship with management will solve this turnover issue. An alternate solution is that I would consider is increasing the pay raises and incentives for performance. Doing this gives healthcare workers a reason to commit to an organization long term. But my recommendation is that Children's Medical Group consistently examine their work environment. This can be done by having a system in place to promote development of their workers. In the article, the relationship between leadership style and turnover intention of nurses in the public hospitals of Jordan, it brings up that transformational leadership is shown to combat the increasing turnover amongst healthcare workers. Children's Medical Group management will be able to fix their current issue by interacting and utilizing collected employee feedback.